It is a pleasure and an honor to welcome you to this talk. My name is Linda-Gail Bekker, and I am delighted to talk to you about a vision that is close to my heart. Imagine happy, healthy adolescents worldwide. Today, we will be focusing on the unique needs and differentiated service delivery required to support the health and well-being of adolescents. This is a pivotal time in their lives, and our efforts in healthcare can make a transformative impact. Adolescents are not just young adults. They have specific health needs that require tailored approaches. From mental health support to sexual and reproductive health services, we must innovate and adapt our strategies to ensure they receive the care and attention they deserve.
Imagine there's no heaven. It's easy if you try. No hell below us, above us only sky. Imagine there's no countries. It isn't hard to do. Nothing to kill or die for, and no religion too.
In this minute, 2 adolescents died from preventable causes. Almost 400 adolescents and young people will contract a curable STI. 30 adolescent girls discovered that they had a pregnancy that they hadn't planned. Noting that most mental illnesses emerge in adolescence, one person ended their life in this minute, thinking that there was no reasonable hope of happiness. In just this past week, 4,000 young women aged 15 to 24 learned that they would face a lifetime of dealing every day with a virus that brings with it stigma, prejudice, and potential illness and premature death. These young people, and 3/4 of them who live in this region, will have to take medication every day for the rest of their lives, and always think of the risk of transmission to their partners and their unborn and newborn babies. These preventable deaths mean that health opportunities were missed, opportunities missed by ourselves in the health sector.
You carry the weight much better than I do. Day after day, waiting for good news. All of our needs, our hopes and our dreams are waiting on an open door. I see a spark of light in the dark. We'll be stronger than before.
It is a beautiful world, but it is also a restless and intolerable world, and most of all, it is a young and dynamic world. There are 1.2 billion youths aged 15 to 24 in the world today. Many of them live and move on our continent, all have hopes and dreams, and share a future. Adolescence, as we know, is an age of transition and great change. Physically, socially, and psychologically. With sexual maturity, hormones are unleashed and brain modeling continues. First, the back part of the brain develops, enabling impulsiveness and experimentation critical to how to learn how to leave the childhood phase. The more considered, reasonable executive function of the forebrain only really kick in towards the end of the adolescent period, allowing the final transition through adolescence to adulthood. This allows separation from caregiving adults, increased autonomy, discovery of sexuality and gender identity, increasing experimentation, testing boundaries and limits, experimenting possibly with substances, courting risks, and displaying apparent disregard for long-acting consequences. This, of course, has been happening for decades, even centuries, and it is the natural physiological and psychological development that is required to move a child to an adult and ultimately to a parent in the perpetuation of Homo sapiens. It is exactly the same principle required to get the bird from the nest, get the lion cub into the pride, and the blue whale to leave the mother's side. There are, without doubt, many aspects of modern-day living which can make this time risky and fraught with dangers, and as adults and parents, we are correctly anxious. But does this mean that we should mothball our adolescents for 12 years? Can we forbid natural experimentation, treat them like children in the hopes that they won't grow? We cannot withhold critical information, tools, and innovation in the hope that during this important period, risks and difficulties would simply disappear. On the contrary, we must see the period as a time of opportunity and skills building. We must cash in on evolving capacities. Thus, we can entertain the concept of harm reduction, safely enabling and safeguarding in the transition without stifling it, allowing our adolescents to flourish. Our task is to provide health services that work for adolescents. We can use innovation and modern technology to do so.
Youth have been telling us for decades, and continue to do so, what they need from us. It is simply us who will not hear. Simply put, young people want to self-care. They want to thrive and flourish, and they want to live their best and healthiest lives. But they come up repeatedly against health systems that are fragmented, prejudicial, difficult to navigate, unaffordable, lengthy, and complex. This is a sad excuse for a health solution that is totally lost on a brain, a lifestyle, and a psyche that craves, as they have told us repeatedly, a viewpoint of the here and now, speediness, tolerance, transparency, friendliness, privacy, respectfulness, and low cost, that provides tailored information on treatments, prevention, and care that preferably can be carried on a phone or in their pockets. It should speak to peers and groupthink, and of course, it should be fun and very direct. So then, what are the challenges that we are responding to? And of course, we know in our region, these are real challenges. So on the side of education, the rate at which young women are able to complete secondary or even tertiary education, leading to huge unemployment difficulties and problems. We know on the communicable disease side, we are the region most hit by HIV, STIs, and all that comes with that. And then, of course, unmet needs, such as mental health support and contraceptive need. This, in turn, requires a response that considers and integrates HIV care and prevention, sexual health, STI treatment and prevention, reproductive health, mental health, and livelihoods. Can we at least bring these components together in an integrated fashion for all adolescents? To date, on the converse, our approach has been siloed, conservative, fragmented, under-resourced, unimaginative, And it truly is no wonder we have left the adolescents of the world underwhelmed and frustrated. So how then can we build a service that adolescents can use? Well, our recommendation is that we start by understanding what it is that the adolescents in your setting, in your corner, actually need. What is the suitcase you need to pack for the adolescent that you're concerned about? Figure out then where best to find them. And I want to tell you, they are not in our health facilities. So we're going to have to look elsewhere. Get imaginative about the platform that you can use. Get creative. Think outside of the box. And then begin to build the system. Start with a positive, gain-framed demand creation and information-giving approach. Think about the entry points that young people may be coming in using services or locations they frequent. People will then start to move towards healthcare, delivery, screening, opportunities to self-care. Adopt a sero-neutral, disease-neutral, service generic approach. Offer the package and engagement, and of course, persistence will then follow with sexual, reproductive, and mental health impact as a result. Never miss an opportunity to provide these services in an integrated fashion. One example we have had the privilege of carrying out in Cape Town is Fast Prep. This is a program where we are bringing, in similar vein to a fast food model, in a hub and spokes approach, PrEP to at least 25,000 people in a single health district, really trying to reach adolescents and young people, whoever they are, however they look, everywhere we can imagine we could possibly find them. And this is together with contraception, point of care STI screening and treatment, HIV testing, of course, pre-exposure, PrEP, art, and mental health support as required by that young person. But we are also experimenting now with adding non-communicable diseases to this packet, to our suitcase, recognizing that we have a new epidemic coming towards us, that of non-communicable diseases. And we're also hoping that this approach, where we combine a physical health together with sexual health approach, that we may be able to reach those men who we know have been missing in action, as well as catering for the new epidemic of diabetes, obesity, and hypertension. So welcome to the new innovation around the Impilo Health Park, where activity, sexual, reproductive health, and mental health are all being combined into one suitcase for young people.
Imagine all the people sharing all the world. You may say I'm a dreamer, but I'm not the only one. I hope someday